Hello and welcome to Health Matters on Channels Television. We are glad you could join us. I am Mary Alale Yusuf. Imagine being able to get healthcare anywhere in the country for anything at any time when you need it. The World Health Organization defines universal health coverage, UHC, as all people having access to the full range of quality health services they need, when and where they need them, without financial hardship. It covers the full continuum of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. This is part of Sustainable Development Goal 3 for 2030, the progress of which the top health body says has stagnated since 2015. The UHC service coverage index increased from 45 to 68 between 2000 and 2021. This is speaking globally. Let's find out what the situation is in Nigeria. My guest on the show is a public health physician at the Lagos University Teaching Hospital, LUTH, Dr. Damilola Akinlawon. You're welcome to the show.
Thank you for having me.
So those were global numbers.
Yes.
And they're already complaining that stagnation started from 2015. Numbers are going down. They're not spreading the universal health coverage and all that. So I'm sure that definition, even the idea of universal health coverage, is too much for some Nigerians. They don't understand it. It's alien to them. So as poor as those statistics seem to be, I'm quite sure ours are worse.
Sadly so.
Can you give us any idea of what our numbers are?
Yeah, so thank you very much for that question. Our numbers are alarmingly lower than that is projected by the global community. We currently, since the last time that we did a projection on how much coverage that the National Health Insurance Scheme has expanded since its erection in 2006, it's still about less than 5% of people that are covered. Projections today put less than 10% of Nigerians at having one form of insurance cover.
One form?
Yes. One form of insurance coverage. So over 90% of Nigerians are uninsured.
Wow.
Do not have any form of coverage, any form of managed care coverage. And over 70 to 75% of expenditure on health is from out of pocket. So
75%?
Yes, please.
That's just way too much.
Yes, and it's more alarming when you factor in the numbers of that Nigeria possesses in terms of the population.
The population,
yes. So 90% in Nigeria is different from 90% in Ghana. So because even Lagos's population alone it's like Ghana's population, total population. So when we say 90%, Lagos as a state the government has really tried and has taken steps in the right direction, but there's still a lot more. There's still a lot more we need to cover.
Okay, I think the best example of blanket coverage in Nigeria is the EPI, the immunization program.
Yes.
And hearing from you, I understand that one has its own issues, even though it's probably the best.
Yes.
What are these issues that we are facing?
So there's what we call the zero-dose children. Zero dose talks about children that have not received any dose of immunization from birth. They've not even received that at birth. And you'll be shocked, it will shock you that we have an alarming number of children that fall under this bracket, even in Lagos.
Why is my question?
Yes.
EPI is free.
Yes. So the government is doing well in that aspect, but the problem is a triad. When illiteracy merges with ignorance and poverty. And sadly, the economy, we are having more people falling under the poverty line. So we have a lot of people that are in the slum areas of Lagos.
So they just don't know.
Yes, that they don't have true knowledge. Some don't have awareness, but that's a minority. Most don't have true knowledge of the importance of immunization.
Because it's one thing to know And it's another thing for that knowledge to propel you to actually go and do something about it.
We our own terminology will say it's one that the first terminology said that's awareness. It's one thing to have heard of it,
yes,
to have the definition of it, but it's another thing to truly understand the importance and agree with that importance and utilize the service eventually. So we are having a lot of people in those slums that are not.
Do you have an idea of how many or the percentage of
the numbers,
zero-dose children?
The numbers now are not being projected, but we know that those numbers are very high. Yes.
Wow.
Yeah.
Okay, so help us understand. Is the backbone of UCH, that's universal health coverage, insurance?
Now, the backbone of universal health coverage is primary health care and managed care. Managed care is insurance.
Okay.
So it's truly, if we want to achieve universal health coverage for Nigeria, in Nigeria, it's impossible without focusing on those two parameters.
Okay.
Now, primary health care is bringing care to everybody, bringing care at the local level, making health care accessible. Because even if you are insured, if you do not have a provider, it does not make sense. Or if your provider is out of reach when there's a health emergency,
yes,
you will not utilize the provider. So primary health care bridges that gap. And Lagos State has really gone far to in terms of making strides towards starting primary health care, expanding primary health care to reach areas. But we still need more. We need more facilities. We need more human resource for health to man those facilities. Then managed care. That's where health insurance comes in.
I will come to the workings of that a little later. But you know, for UCH to work, there has to be a comprehensive national database. You have to know who you're serving, right?
Right.
Is there a proposal for the government to collaborate with health institutions so that the numbers, at least the numbers, are known?
Okay. Yeah, so that's very correct. That all those are already in play. There are policies, there are acts that are in play, and we already know all the actors that are necessary, all the stakeholders that are necessary. That's even what guides the establishment of these conferences that we have, like the just concluded conference. We gathered stakeholders ranging from government, key stakeholders for health, to managed care personnel, key managed care personnel, both in the private and in the public sector. You know, we had a release that's for clients that will use those services. We had practitioners, key practitioners that are known in healthcare in Nigeria. So they will discuss, and then they will come up with conclusions on the way forward on how to accelerate UHC.
Okay, so let's see whether we can get some of these, resolutions or, pointers to them anyway. So as it stands now, we don't have enough health personnel.
Yes.
Even without considering the UHC.
Yes.
On a normal day,
yes,
there are not enough doctors.
Yes.
There are not enough nurses, not enough lab technicians, pharmacists, and so on and so forth. The almighty Jackpot syndrome. Now, we need people,
yes,
to make this work. What is a practical thing that has been put down, practical steps to get people in, or at least keep them in?
Okay. All right. So
happily.
All right. So first, I was established that the things that guide the jackpot syndrome could be personal, professional, and then the environmental factor that is causing the massive rush. So personal could be, I have a wife that is going, so I'm just following her, though I'm a doctor. So professional could be, there are some specializations, some super specializations that are not offered in this country. Okay. So if I want to get those specializations, I have to go.
Have to go out.
Yes, but that's not what we're talking about. We're talking about the environmental factor, where factors in the country are driving people that would otherwise stay and have faith in the country to go. Right. So there's something that the Commissioner for Health said. He said government And I agree with him. He said government plays a key role in whether the health sector will be that of default or that of design. That whether we are going to construct a health sector that we can embrace and be proud of, or whether we are just going to let everything, let's see how far
Just
it goes.
go to the dogs or let it ride.
There we are. So government will play a key role, because the reasons why these doctors are leaving is not shrouded in mystery. It's really clear. Security,
Equipment,
remuneration. That's it. So it's very clear. The parameters are very clear. So now it's for government to rally up.
And really, security is out of your hands.
Yeah, but we can work on it. Now and then. Now we're even having, it's metamorphosing. We're having corporations jackpot too now. We're having pharma companies jackpot.
Yes.
And it's going to increase the price of medication. It's going to increase the price of care. It's going to make managed care in health insurance much more difficult.
So the time to act was yesterday. No, I mean seriously.
Yes, the best
it's
time
now
is
an
was
emergency.
Yesterday.
So
Yes.
many corporations closing, packing
Yes.
up and leaving, and sometimes embarrassingly
Yeah.
moving to other smaller African countries that they feel are safer and more stable than
Yes.
Nigeria.
That's it. Yeah.
So, is anything being done? Is my question.
Right, now I will just talk about political will. When I said the government has to have political will focused on health. Because the truth is, any country that will move forward has to put health and education at the forefront of its priority, because health is life, and education allows people to
Only a healthy
understand.
person can make money for you.
That's true. That's it. Only a healthy person can be a citizen. That's it. So when we have conferences and gatherings like the one we just had, we draft communiques that can be used to inform government on steps that can be taken, that on the way forward at every point in time. So, like the conference we just had was very key, was very important, and it's drafted a lot of information that we are going to draft and send to the government. So now the
At
onus
least you have a
will
solid
rest.
proposal.
Yes.
Okay, so that's a start.
Yeah.
Let's talk about how this UHC works.
Okay.
What goes into it? It involves HMOs, right?
Right.
Health management organizations.
Right.
People distrust those things.
Right.
They say that they are Shylocks. they're just in it for my money, and I'm not going to use any of those people. Yeah. Sometimes you see the bill through the HMO, and you're like, no way did I spend all this money on this simple health problem. So how does it work?
Okay, the first thing is we need to have more community participation. It was said that at the conference, and that's so key, that people, if you cannot get the people that are going to benefit from this service to believe in the service, no matter how much money you pump into the service, you will not be able to get the progress.
So it's the numbers that will make it.
Yes, that's it. People need to understand what is health insurance. People need to be educated on what it is, on what the benefit is. People need to understand that it's for emergency purpose. We need to get to the point, I was saying it earlier, that we need to get to the point where it is socially unacceptable not to have a health plan, not to be under a health plan. Just as it's socially unacceptable not to have a smartphone now. So we need to have people. So the awareness is being spread by people. You understand, as
Yes.
against being pushed by government alone or by private entities.
Okay, so if somebody comes to you and says, I want to have a health plan,
Yes.
I want to be under this universal health coverage,
Right.
what are the steps you give the person?
Very good. So there are both government and in Lagos State, there are both government and private initiatives out there that are very accessible, that are so accessible, and that of Lashma is very affordable. You understand? And it's very reachable. At the touch of with your smartphone, You can easily Google Lashma. You'll see the Ilera Eco initiative that is being run by Lashma. It's very innovative, and we got to hear a lot about it in the conference. And it's very accessible, from the comfort of your home. You can, find out how to get registered online, get registered, and then benefit from that service.
Okay. Yeah. We are going to come back from the break and talk a bit more about this. Please stay with us and meet us on the other side of this break.
Thank you.
Welcome back. We're talking about universal health coverage in Nigeria. This is Health Matters on Channels Television. And we are speaking with Dr. Damilola Akinlawun. So, you can call if you have questions on, and I imagine many people have questions on health insurance. You can call 0808 054 2233. You can also send an X message. They don't say you can X. At CTV_Mary A. And then also send email to moalale@channelstv.com. You should be seeing that on your screen now. And just call with your questions while we go back to the guest and talk. Okay, so let's say we've chosen an HMO for right. This your prospective patient. Lashma, is it an HMO first of all?
Lashma is the Lagos State Health Management Agency. It's a Lagos State government initiative.
Okay, so people living in Lagos can use it.
People living in Lagos.
If they use it,
yes,
they don't have to have another HMO, do they?
They do not, unless they want to.
Unless they want to.
Because law allows you to have more than one.
And this they can do at the touch of a button.
Yes,
on their phone. Yes. They just go to Lashma. All right, that's clear enough. Yeah. I wonder what other states are doing, because then should there be, or is there, a federal government plan? What if your Lagos State person is in another state when an emergency occurs?
Okay, good. Now, even the Lashma initiative, they are partnered with private organizations, private health insurance organizations. You understand? We were graced to have them at our conference. So there are also private health insurance organizations that operate all around the country.
Okay.
You understand? And they are
maybe
relatively
you have
affordable.
An agreement with X hospital.
Correct.
And they have branches all over the place.
Correct.
So
that's it.
You can have your emergency anywhere.
Anywhere.
Those branches are.
Yes, anywhere.
Now, we saw the definition of universal health coverage.
Right.
We're talking treatment for anything, anywhere. How far does Lashma go?
Well, no, Lashma is a Lagos State initiative. So it goes, it's
I'm talking
in Lagos State.
I'm talking
for now.
First and foremost, we would love to have treatment for the more complicated matters in life, surgeries and all that.
Okay.
But does it at least cover the basics?
Good.
Malaria,
good.
Childbirth,
good.
Immunization.
Right.
Aha.
So the concept of insurance, so if anybody comes out, any facility, whether private or public, comes and says, we're going to give you managed care, we're going to give you insurance, you're going to be covered, it means you're going to be covered for the basics. And the basics are outpatient clinic care, meaning you are ill, you came, you saw the doctor.
You didn't have to be
basic
admitted.
Public health, yes, the basic public health illnesses, like the ones you've mentioned. It also includes antenatal care, because that's very important. And it should include, basic. Yes, and then basic inpatient care, meaning the basic diseases that will cause one to be admitted. Like now in children, diarrheal disease is the #1 killer. So
cholera.
Yes, that's so good. So diarrheal diseases, if a child is having a diarrheal disease, he comes into the hospital, he needs admission, he should be able to get coverage, he should be able to get quality care under the managed care. So both private and public
but his
should be able to achieve that, yes.
Have had to pay a certain amount every month, right?
Correct. They
To
pay
cover
premium.
themselves.
Yes, that's it. So the premium could be monthly, quarterly, or yearly, depending on the organization and
So what
the
happens
person
to
that is
people
enrolling. Yeah.
who are very low income earners and they're not even taxable?
Okay.
Then they get sick.
Okay, that's it. So that's the coverage, that's the gap that we are highlighting now. That's the gap we're trying to highlight. That
Okay.
there is a lot of people below the poverty line that may not be able to afford, you understand, even any premium, that may not be able to afford. So that's part of the reason we gather stakeholders to discuss and to see what are we going to do for them, because they are Nigerians too.
Yes.
And we need to cover
And they
them.
deserve care.
And they deserve care, no matter what. Every health is a human right. That's as long as you're a human being, you deserve care, you deserve help. So the initiatives on ground now are trying to expand to reach them. That's it. So that's the problem now with the inflation and then the JAPA that is reducing our human health workers, is stalling that. You understand? Generally, economy is largely responsible for the downward progress, the downward rate of progress from 2015. So there's really a lot of
This is a lot.
yes.
This is a lot we are talking
We're
about.
still in the middle stages. Really.
Okay, so let's assume we get these zero, what do you call them?
Zero dose children.
Dose babies,
Right.
these zero dose children.
Yes.
And some of them agree. Some of their parents say, okay,
Yes.
we've heard you. It's a good idea.
Yes.
Then you have this deluge of babies coming to you. Do you think maybe this is a bit premature?
That
Maybe you can't handle?
Oh no, they can handle. No. What is on ground now? The facility on ground now can handle immunization for everybody. The problem, people are not getting immunized not because immunization is unavailable, or because the person to administer the immunization is unavailable. No, people are not getting immunized because they are not going for immunization. They are rejecting immunization.
Do they have any false beliefs about these things?
Yes.
Any myths? Can you tell us some of these things?
Yes.
Things that are running through their minds.
Right. So even first I'll start by saying they are anti-vaxxers. One of the things we discussed at the conference was we as public health physicians and stakeholders and even media partners, we hold a strong role in ensuring that vaccination, the technology of vaccination is accepted, and that people know what it really is and how important it is to their well-being. We can see, like now, for instance, over the decades, the advent of polio has dropped massively. Yes. Before, it was quite common in 3 families to see at least one person that is limping. Yes. But now it's like a fantasy.
Now it's like an abomination.
Yes.
Someone like me would ask, where were you when they were taking polio doses? I mean, there are some things that shouldn't happen today. But some anti-vaxxers will tell you that they believe that they can't really take vaccines for one reason or the other. But they are working towards being covered by herd immunity. What do you have to say to that?
No, they need to be vaccinated to achieve herd immunity. Vaccination, the acceptance of vaccination is the way to achieve herd immunity.
And you can't be the one to excuse yourself voluntarily from that.
Yes, you need to be vaccinated to achieve herd immunity. We need to vaccinate a very vast number of people for herd immunity to occur. We're talking of 99%. So the mindset should be we are vaccinating all. And we do have facility to vaccinate all. So now, even in Lagos, there are, like, despite the anti-vaxxers thing, like it's going to sterilize your children, it's going to kill your children if you get vaccinated. I was in Ajegule like some few months back, and they were just doing another round of polio doses, and some of the people were almost violent.
Wow.
To the yes, to
Even in
the people are in
2023.
2023. Oh, this is just a few months back, right? So they were
After
almost
COVID.
yes, they were violent. They had to leave their stations for fear of physical assault, because the anti-vaxxers had come the night before, throughout the night with speakers and saying that they are coming with a vaccine and don't let them give your child the vaccine.
But you know, a very simple way of countering this,
Right.
at least this particular myth,
Yeah.
is to show them people who have been vaccinated and have had children. Shouldn't that solve it?
Yes, that's on a large scale that will solve it. That's why we need to double up on our advocacy. We shouldn't let the anti-vaxxers beat us on social media, for instance. Now, whether we like it or not, social media has come to stay, and social media is the strongest weapon of information out there now for people, for health information or education or counseling. So we should use it strategically, intentionally, and that's all the partners, all the actors need to come and utilize it so that people are already aware. People are already, they've already received knowledge, they've already received education on it. So when they want to receive counter education that does not make sense, it will clearly not make sense to them.
Okay.
Yeah.
At this point, I have to thank you for coming to the show.
Thank you.
Channels will always partner with you for things that will keep the community safe.
Thank you.
I've been vaccinated and I have children. Thanks for coming to the show.
Thank you for having me.
Lovely to have you. Thank you for being there with us. Have a lovely day. I am Mary Alale Yusuf.